Hello, my name is Drake Baston, and I am a distance learning student at Indiana State University. And for my community health course presentation, I will discuss the increased risk of HPV and associated cancers in unvaccinated populations. During this presentation, I will discuss these learning objectives. What is HPV? Health risk associated with HPV. Who is at most risk for HPV, importance of the HPV vaccine as preventative health care, barriers associated with HPV vaccine administration, interventions to promote education and vaccine adherence, and knowledge of the positive outcomes from being vaccinated. Before I begin, I would like to pause for a 10-question pretest. So what is HPV? HPV is the human papillomavirus. It's a collection of viruses, up to 200 variations that are related and common among all populations. However, two forms are distinguished as the most common infections from intimate contacts or sexually active men and women. First one is low-risk infections, which have a low prevalence of symptoms but can develop skin warts in some cases. The second is the high-risk infections, which have the ability to cause cancer from at least 14 strands of HPV. Most commonly is cervical cancer. Strains 14 and 16 are specifically known to cause cancers. High-risk HPV is generally asymptomatic, and healthy immune systems eradicate potential for harm. However, if the virus remains active for a durable amount of time or years, then cellular damage from the virus can develop into cancer without treatment. Health risk associated with HPV. HPV high-risk infections that go undiagnosed or untreated are associated with certain types of cancer, specifically to the genital organs on both men and women, as well as the mouth, tongue, and tonsils. Almost all cervical cancers diagnosed are linked to HPV. Fortunately, declining rates of cervical cancer in the United States is connected to better screening and interventions. The most prevalent HPV-associated cancers today are seen in the mouth or oral cavity, such as the tongue. Other areas of concern that are highly associated with HPV are anal, penile, vaginal, and vulvar cancers. HPV has little to no symptoms, especially the high-risk types. Once prolonged cell damage occurs, lesions may develop with possible itching or bleeding. If cancer is suspected, the patient may have symptoms such as itching, bleeding, swelling, or pain. In less developed countries, cervical cancer caused from HPV is associated with the highest levels of mortality due to lack of prevention care and early intervention care. Importance of early administration of the HPV vaccine. The CDC emphasizes the importance of early vaccination for children starting as young as 9 years of age. Depending on the age of the first vaccine given, there will be 2 or 3 doses to complete preventative measures. Doses given between the ages of 9 or 12 should receive another dose within the next 12 months. Doses started for adolescents around 15 years old will need 3 doses of the vaccine. Early vaccination for both boys and girls is recommended well before potential exposure, because we know that exposure is almost inevitable throughout a lifetime. The HPV vaccine prevents the virus or infection to people who are exposed and ultimately preventing cancers associated with high-risk HPV. Barriers and populations at risk for not receiving the HPV vaccine. According to Healthy People 2020, the set goal of fully vaccinated individuals that were eligible to receive the vaccine went unmet with less than 80% or more of the population. The African American population has a significantly lower rate of vaccine administration in comparison to other races in the U.S. Yet there is a greater probability for African Americans to acquire HPV-related cancers and up to an 80% chance of mortality. Reasons identified for the disparity is 1. Lack of evidence-based education to the benefits and timeliness of the vaccine. 2. Beliefs about the vaccine promoting early sexual behaviors in children and adolescents. And 3. Mothers' apprehension to vaccinate, fearing side effects, skeptics of healthcare, social, and ethical beliefs. Acceptance of the vaccine with African Americans and the mother's decisions to proceed is heavily influenced by the healthcare provider's recommendation and value of the vaccines as positive. Interventions promote vaccine acceptance. Educate parents at routine office visits early on, mothers in particular, for the reasons for the early vaccine schedules and remove the perceived stigmas related to the vaccine through continued education. Ensure all children are equally provided access to the vaccine since males are less vaccinated than females overall. Focus on the facts: HPV prevalence, the relationship of specific cancers, which are commonly asymptomatic, leading to late diagnosis and poor prognosis overall, support from healthcare providers, organizations, and community involvement to relate accurate information to the public on the safety and effectiveness of the vaccine. And healthcare professionals are essential to communicating and advocating the importance of prevention of disease by methods such as the HPV vaccine. Additional health prevention with routine screening. Pap test or smear is a sample of cervical tissue which is obtained and tested for abnormal cells that can detect cancer or precancers and viruses such as HPV. Screening is recommended for females starting in their early 20s. Exam frequency is determined by your healthcare provider, but generally is 1 to 3 years. Women 30 and over can vary from yearly to 5 years of surveillance, depending on individual health risk and prior exam results. In conclusion, community and professionals factors are needed to overcome the barriers related to the HPV vaccine. Community programs, schools, and public leaders are essential to inform surrounding populations with current information on wellness and prevention healthcare and its importance to healthy lives. Healthcare providers implementing protocols and education to advocate for the vaccine's importance of preventative care is invaluable as parents rely heavily on the recommendations received from their trusted nurses and doctors. I have listed a couple additional resources if you would like to check them out here. Thank you for viewing my presentation, and don't forget to take the post test afterwards. Thank you again.